بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is a new case discussion. As we see here in this patient, abdomen CT scan below at the level of the lower kidneys after IV contrast. And we see in this patient presented with abdominal pain. As we see here, ovoid well or sometimes maybe ill-defined increase attenuation of the mesenteric fat and with thickening of the mesenteric fat and also some nodules here. And we see the fat around the blood vessels is preserved. And this we call it fat ring sign or fat halo sign. And the case, it is called sclerosing mesenteritis. What is sclerosing mesenteritis? It is an inflammation involving the mesenteric fat, and it is a rare idiopathic disease associated with fibrosis, as we said, inflammation. The etiology of the sclerosing mesenteritis is unclear, but it may be, as we said, it is presented with abdominal pain, more than specific abdominal pain, and can be also asymptomatic. And also it is male predominance, and the usually patient is above 60, but it is maybe linked with other conditions like it may be linked with other conditions like systemic lymphoma, gastric carcinoma, recent abdominal surgery, idiopathic inflammatory disorder, bowel neoplastic syndrome, ischemia, infection, and autoimmune. The best diagnosis is for this case. It is a sclerosing mesenteritis, is the abdominal CT scan, and it is the most sensitive modality, imaging modality, and the diagnosis is confirmed by surgical biopsy. Usually the treatment, it is supportive treatment, surgery intervention, it is rarely used, and sometimes complication may be appear with this patient needing surgical intervention. So this is a case, recap, this is a case of sclerosing mesenteritis. It is rare disease, unclear inflammatory with inflammatory changes involving the mesenteric fat with some fibrosis, and the fat around the blood vessels is preserved. It is fat ring sign or fat halo sign. It is treatment, it is supportive treatment, may be associated, as we said, with other conditions. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك استغفرك واتوب إليك.